Hello, everyone. Thank you for joining us for Joy in Our Town. I'm Aaron Motley. Joy in Our Town brings you information regarding the issues and problems we face in our local communities in hopes of finding some solutions. On this first portion of the program, we have with us Clemmie Palmer III, MD, and he's going to talk to us today about obsessive compulsive disorders and the symptoms, also some effective treatments for this disorder. And we thank you for being with us on Joy in Our Town today.
Nice to be here.
Maybe you can just start off by explaining to us what exactly is compulsive obsessive disorder.
This OCD, we call it OCD, it's an anxiety disorder. Obsessions are recurrent, intrusive thoughts that are unwarranted that cause much distress for a person. Compulsions are behaviors done in response to these obsessions, and they're also unwarranted and intrusive and excessive.
Okay, so you're saying then that this is something that is brought on by some kind of situation that happens in life that brings on anxiety. It is not something that a person is necessarily born with.
Yes, sir. Yes, sir.
Okay. Explain then to us what are some of the behaviors that we're talking about?
Excessive hand washing for patients that worry about becoming contaminated with germs, checking, rechecking all day, repetitive mental acts, praying is an example of one. Walking a certain way, making sure blinds and books are real straight on the desk, kind of excessive behaviors like that.
Excessive behavior, doing things over and over more than is necessary.
Yes, more than a normal person. I mean, we're talking about hours, not just a day, but it can be 10, 12 hours a day that preoccupies your time.
Okay, now you mentioned praying. Maybe you need to kind of get on, because people do pray all day long. People believe that they should pray and not faint, for instance, not giving up in prayer. Well, kind of elaborate a little bit on that.
Sure. For example, if a person has murderous impulses, now they're not going to kill anybody because it's just an obsession. They may develop a compulsion to pray in their mind repetitively over and over and over, only because they have the impulses already there, the thoughts that they may kill somebody. They're not homicidal, but they just have these thoughts. Therefore, they develop a situation in their mind to reduce the anxiety of the murderous impulses. Compulsions, obsessions, causes anxiety. The compulsions decrease a person's anxiety. So prayer is a way to decrease the anxiety they have of the murderous thoughts.
Okay, so the thoughts would be the problem, not so much the prayer.
Exactly.
And these are prayers you're talking about that may be fear-driven, but not necessarily a prayer just to keep a fresh relationship with the Lord, for instance. So that would be a big difference there. So it's nothing wrong with praying a long period of time, but it's what is driving that prayer is really what you're talking about here.
Right. The prayer is based on pathology.
Okay.
Right.
All right. Very good. Now, we want to go on into understanding this a little bit more, because, people feel like sometimes that some of these behaviors are very normal. If they feel like, well, my hands are dirty, I have to wash my hands over and over. Maybe you can talk to us about how we can tell when it's out of hand, when these behaviors become more than necessary, and how can we tell it in ourselves or even in someone else?
Yeah, these behaviors and obsessions cause marked distress socially, occupationally, or academically. For example, if a person has to check their lock set before they leave the house 20 times or iron their clothes 10 times, they may arrive to work late every day. So it'll become a problem. And also I look at the time. If something's going on for 10 hours, 5 hours a day, it's excessive. Now, a lot of people may check their doors 1 or 2 times. That's okay. That's probably less than 10 seconds. But when you start checking doors and locks, and it takes half of the night, that's just out of the ordinary.